them work, that stress and tension worked out of each toe. Also, it helps if they pop. That's a little bit of air that's in the joint helps. Now we're going to do circular thumb strokes on the bottom of the foot. You can take a little bit more time if you like, or less time. Just make sure you get that foot nice and worked out. Now we're going to do some circular motion with the knuckles. This feels really good. All around the ball of the foot into the instep. That feels great. Like I say, you can take as much time as you want with these feet. Sometimes people like their feet worked on a lot, depending on the client. Now we're going to cool down with nice gentle strokes. A little bit of foot boogie when you get a chance there. Up into the ankles. That's good. Now we're going to redrape the foot, and we're going to begin our leg sequence. The next thing you need to do is to, of course, plunge your hands with either a baby wipe or something similar. After finishing the feet, we're going to begin draping procedures for the anterior leg. We're going to roll the sheet up and drape the leg so we create this professional barrier. We're going to lift the leg up and pull the sheet from underneath. So we even have a little handle there that we can give to the client, and he can pull it tight. Now the first thing we're going to do, of course, before we begin any sequence on any body part, is effleurage, which is the warming up and assessment phase of the massage routine. So we're going to start from the bottom. We're going to go slowly, and we're going to move up through the lower part of the leg, lightly over the knee, up into the quadriceps, and come down. Really spreading the oil, warming the area up, and paying attention to any tight areas that we may feel along the way, with some nice connecting strokes coming back down. We're going to work each side of the tibia and fibula with thumb stroking, circular type movements on each side of the lower leg bones. This is the anterior tibial area. It feels very, very good. Now after we finish this area, we're going to go up into the quadriceps, and we're going to pull the quadriceps in a ringing type motion, just like we did on the legs and the back. Being ever mindful of the barrier that we have set, and not to go too far beyond that barrier. We want to stay within that barrier. And now, as we did on the back of the leg, we're going to start from the ankle area, and we're going to do a deep effleurage, hand over hand, for the deep lymphatic drain. Remember, once a month, but go lightly and do the stroke at any other session, any other time. Go lightly over the knee, and really look how nicely she works the quadricep area, those big leg muscles. Come back down, hand over hand. This is a nice draining effect. It also drains the tension out of the muscles in the leg. That is using very good body mechanics, remembering to center your gravitational area in the pelvic area. And the strength is coming from your torso rather than your arms. Now we're going to gently stroke up the leg and vibrate down in a cooling down motion. Getting ready to do our leg stretches, our anterior leg stretches. These stretches that we're going to start are really good because we stretch all of the joints in the leg. We're going to cup the ankle in your forearm and gently pull the foot to stretch the calf. Okay? Come back down for the second part, and we're going to invert. Okay, now we're going to invert the foot and evert the foot, the ankle. The next stretch will be to bend the knee, taking the heel to the opposite knee. And we're going to take our hands and we're going to push down on the medial edge of the knee by bracing the other part of the hip and stretching that whole hip area. Many times if there's any kind of imbalance in the lumbar spine, sometimes this will detect that. I'm going to gently push down on the knee and brace the other hip just as far as it will comfortably go. Okay, the next part of the stretches will be to bring the knee up to center and to pull the leg down. Now we're going to do a hamstring stretch. So we're going to gently take the leg up, keeping the knee as straight as we possibly can, and having the client hold on and drape the area tight and just take it up as far straight as it will go comfortably. And that's it. Now we're going to take our forearm and put it just below the knee joint, and we're going to do a glute stretch by taking the knee up to the chest as it will comfortably go. Good. Now let's take the knee back to center, and we're going to bend the area, the hip area, to the other side and take the foot up slowly toward the head, the table. This stretches the piriformis, one of the 6 deep lateral hip rotators in the gluteal area. Okay, that's the end of that sequence. So we're going to bring the leg down, do a nice little vibration down, and a little tug at the end. Good. Now we're going to undrape and move to the other leg to do the same sequence over again. Now we're going to drape the other leg, begin the leg sequence all over again. Remember to pick up the leg, pull the sheet through, creating the professional and personal barrier for the client. And then handle. Okay. Of course, we begin warming up with the effleurage strokes. Long gliding strokes, remembering to assess as we go. Nice slow movements so the client feels nice and comfortable. Really warming up the area. Now we're going to work each side of the tibia and fibula with thumb strokes. Nice spreading the fibers of the anterior tibial area. A lot of stress and tension is held here, especially if you're an athlete, and sometimes if you're just a person who's been on their feet all day from a job or occupation. This feels really good and releases a lot of tension from the area. After we do this, we're going to gently go over the patella, the kneecap, and go into the push-pulling motion, like a ringing motion of the quadriceps. These bigger leg, upper leg muscles, really working the area, pulling and draining the tension right out of that area. And we're going to do that about 3 times. But of course, as the therapist, you'll want to meet the needs of the individual, needs of the client. Now we're going to go back down near the feet, start from the ankle, and do a hand over hand lymph drainage. Remember, only once a month. or when the client needs it, but it's something that we'll do every time, but just not as deep. We go all the way up into the quadriceps and start it all over again. This is a good cleansing, moving that lymphatic waste up into the inguinary drainage ducts, which are located in the groin area. After this, we're going to stroke up the leg and vibrate down for a cool down. We're actually moving this sequence along a little bit faster, just for demonstration purposes. You want to take your time and work it into your hour massage or hour and a half, whichever you choose. But we're cooling down the leg now, getting ready to do our leg stretches, which are very important. The first stretch begins with cupping the leg, putting the foot, stretching the calf area and the Achilles tendon by moving up. Okay? The next sequence of this stretch is to plantar flex the foot to stretch the anterior tibial area. And then we're going to invert, and now we're going to evert the foot. And then we're going to go to the next thing, which is to bend at the knee, taking the heel to the opposite knee, bracing the hip from the opposite side, and pressing down on the knee for the stretch. Take it down as far as it will comfortably go. Now we're going to move into the next stretch by bringing the knee up to the middle, and we're going to go into a hamstring stretch. So we're going to take the leg and straighten it up as far as it will comfortably go and stretch. You want to be mindful of people that have low back problems, because sometimes this stretch really aggravates their condition. So just take it up as far as it'll go. Now we're going to take our forearm and put it directly right underneath the knee joint and move into a stretch that goes right up to the chest. This is for the glutes. And take that as far as it comfortably will go as well. Now we're going to take the knee back to center, and we're going to take the foot and bring it up toward the chest. Again, as far as it comfortably will go. This is a stretch for the piriformis. Okay, now we're finished with the leg stretches. We'll take the leg and put it back down, vibrate the leg down, and give it a nice little tug at the end. Now we need to redrape, undrape and redrape. And we're going to move on to the next sequence, which is the abdominals. The abdominal area is an area where a lot of vital organs are placed, so it's a very vulnerable area for the client. So I suggest always asking permission to work on the area before starting.
Joe, may I work on your abdominal area?
Yes, you may.
Thank you.
Okay, now we're going to pretend Joe is not a male today. We're going to pretend Joe's a female. And we need to show you how to drape in order to protect the privacy of the client. So you're actually going to put the towel over the top of the breast area, and they're going to hold on to the towel while you pull the sheet down to below just the abdominal area. So they have a protective covering over the breast area. So you're going to fold the towel to expose the abdominal area. And the first thing you're going to do is measure about 1 inch to 2 inches underneath the xiphoid process, which is the little cartilage protuberance that comes down at the end of the sternum. You're going to go below that area because you don't want to touch that area. And you are going to petrissage, or do clockwise effleurage actually, under the ribs. along the oblique and back around, just like Patty is doing. And the reason we're doing this in a clockwise motion is because this is the motion of your digestive processes, so we want to flow with it. A lot of times this really helps with constipation and any kind of stomach problems that you may be having. It's a gentle clockwise motion that helps the client even relax a little bit more. After we've done that for a while, we're going to go and we're going to do a little bit of a diaphragm pull. And this is a gentle motion. This really helps the client to open up their diaphragm and breathe a little easier. Now we are again going to measure just about an inch, inch and a half underneath that xiphoid process at the end of the sternum. And we're going to take both hands and in a V-like motion, we're going to have the client take a deep breath. And on the exhale, we're going to gently pull down all the way down into the navel area. And then another inhale from the client. Go back up to the area where you were in a V angle. There we go. Just on the exhale, pull that down. Do that 2 or 3 times. And it really helps the client to breathe easier. We all breathe rather shallow, and this helps to open up those the diaphragm area. Okay, that's pretty much it for the abdominal area. So we're going to redrape and just cover the client back up again. The next thing we're going to do is go to the pec area, the pectoral area. Pectoralis major clavicular, pectoralis minor. We're going to work that area. So you see the client is holding the sheet. We're going to pull the towel out from underneath and begin to drape to work on the pecs. So on a woman, we don't want to come very much farther down than that because it's all mammary glands. There's no muscle tissue except underneath. So we're going to work the surface muscle tissue by warming up the area with effleurage, ever mindful of the privacy and protection of the client. Very, very important. We're going to do gentle effleurage on each side of the pectoralis major clavicular into the deltoid. Just move in an outward motion, being careful to work underneath the clavicle, which is also known as the collarbone. We're going to thumb across the clavicle in between the top and the bottom of the clavicle. Really work with some nice cross fiber friction. There's a lot of stress in these areas, so this feels really good. You want to take your time, ever mindful of the privacy of the client. Now we're going to do some light cross fiber friction across the pectoral muscles.